Welcome to the Diabetic Mogul podcast. In this podcast, we offer standard and recommended practice of not only managing your diabetes, but also how you can get involved by advocating for proper access to healthcare. Join us in this season as we host various guests within the diabetes community from around the world to learn from their shared experiences as people living with diabetes and as healthcare providers. I'm your host, Tino Tendadzige, the Diabetic Mogul and a patient advocate, with the vision of empowering, educate, inspire the diabetes community in the best way I know how. To do this, we offer articles, we record podcasts, and we volunteer with various organizations. And on this platform, you can find my links via my social media platforms. On this episode, we are privileged to host one of the qualified podiatrists in Zimbabwe whose passion is deeply rooted in the care of the foot. Please do take it away.
Hi, Tino. Thank you so much for having me. I'm so happy to be here. Thank you so much for the opportunity. Okay, so my name is Leevonia Paidamoyo Muzamhindo, and I'm a qualified podiatrist. A podiatrist is a healthcare professional, who deals with conditions that affect your feet. So we assess, we then diagnose, and we treat any conditions that affect your feet. I studied at the University of Johannesburg and graduated in 2019, and I've been in the field for about 2 years now.
Thank you for honoring our invite, our podiatrist. It is a huge privilege to have known you and now to host a profession in a certain field, someone who understands the foot deeply, and in this case, foot care on people living with diabetes. Tell us why it is important that people who are living with diabetes do take extra caution on their foot.
So yes, foot problems in diabetes are quite common and very, very costly. So it is very important. It was important for our diabetic patients, to take extra caution with their feet. The reason why we have to take care of our feet is the fact that diabetes damages your blood vessels. So the blood that then gets to your feet is decreased or is compromised. So as a result of this, we get what we call peripheral vascular disease. And if you get a wound, it then doesn't heal, and it is very easy for you to get an infection. So that is the first thing that diabetes does. The second thing that it does is that it damages your nerves. So your ability to perceive touch, pressure is compromised as well. And this is a condition that we know as neuropathy, right? So as a result of the neuropathy, we get symptoms. Our patients come in and complain of tingling, loss of sensation, numbness, burning. All those are then the symptoms of neuropathy. So that is what it does, diabetes. That is what diabetes does. It affects our nerves. So when the feeling is then compromised, it is easy for our diabetic patients to then hurt themselves, and this can then go unnoticed, and then it can go untreated. You find patients that hurt themselves, and then they only find out maybe later on when the wound is now infected, and a lot is now happening. So this is what diabetes does, and if we know this, we then can conclude to say that it is important that people with diabetes take extra caution of their feet.
Thank you for that amplitude of information. Now, if you could tell us, what is the role of a podiatrist, especially linking with your significance to people living with diabetes?
Oh yes, Tino. So as podiatrists, we have a very big role in the management of our diabetic patients. Firstly, our role is to educate our patients. So we educate our patients. Firstly, we educate them on the complications that the disease has on their feet. So like we discussed earlier on, we would then tell them about the fact that diabetes causes neuropathy, causes peripheral vascular disease. We then explain that to them so that they understand. And then the second thing is that we educate our patients on how they can then prevent these from happening, because there are ways that if one follows, they then put themselves at a lower risk of having these complications. Our role also is to assess the patient and screen the patient. We have various screening tools that we use that help us to establish category that the patient is in. So we then screen for peripheral vascular disease, we screen for neuropathy, and we just want to see the color of the feet, the texture, the temperature. All this will help us to then categorize the patient and then put them as low risk, as medium risk, or as high risk. So if a patient is then low risk, they would have to come once a year for another screening. If they are high risk, they would have to come maybe after every 6 weeks. So when I say that a patient is high risk, I mean that they would have ticked a lot of boxes. So they would have neuropathy and peripheral vascular disease, and also they might actually have active lesions or active ulcers. So a patient then is considered high risk. So that is our role. We then categorize our patient and then act or manage the patient according to the category that they are in. Our role is also to treat, wounds. We find some patients present to us when they already have wounds. So we also treat those wounds. We then make sure that they are not infected, or if they're infected, that someone intervenes so that we can then treat the infection and then make sure that the wound heals. Since we work as part of a multidisciplinary team, our role is to also refer the patient to the relevant healthcare professional. So if we see a patient with for example, if you see a patient with a diabetic ulcer whose sugar levels is not controlled, would then need to send that patient to a dietitian, or if they have problems with their medication, we then refer to the physician. So we work as part of a team.
People with diabetes do prefer to discuss or have a chat with healthcare professionals who can easily relate to their issues. If you could share with us your experiences in dealing with people with diabetes, or the challenges that you've faced in dealing with people who have not seen a podiatrist before in their entire life.
A lot of experiences and a lot of challenges that we have seen, or that I have seen. Podiatry is something that a few people know about, especially here in Africa. It is more common in your European countries. So when you come to Africa and you say to a patient, no, you need to see a podiatrist. So if, for example, you're working in a multidisciplinary team setting, where there is maybe a physician, a nurse, a dietitian. If a patient is then referred to a podiatrist, the first question is, who's that and what do they do? So I think that's our greatest challenge. I feel in the country, in Zimbabwe, our field is not really known. So I think that will be the greatest challenge that we face. But hopefully with time, it will get better. Another experience with patient is, I think, patients not knowing what diabetes or how diabetes affects their feet. So you get patients that wear any type of shoes. You get patients that do anything to their feet, so they are not aware. So they don't do it because out of ignorance. No, they do it actually because they don't understand the effects that the disease has, and also the complications that it can cause. So I think just lack of education is what we have what I have noticed. And then another challenge also is with wound management. So if you're managing a patient with a wound, because wound care is a bit pricey, it's a bit expensive, you find out that a patient will come in for 3 visits, and then when they are scheduled to come for another one, they don't come because in terms of finances, maybe things are not going so well for them, so they end up not coming. And because the wound would then be infected and it's not managed properly, some people actually end up having amputations and everything. So I think it's also a challenge that we actually face.
Now moving on to the long-term complications that could come upon a person that is probably not managing his or her diabetes well. There are a number of long-term complications that could come. Maybe if you could guide us on how diabetic foot ulcers form, there's a trust that would help the audience and to remind them to visit a podiatrist, to get screened, to take correctional measures, to avoid amputation or other complications. Please take it away.
Okay, so like we previously mentioned, we talked about the complications that diabetes has, right? Because the complications then answer like the question that you've just asked me about how foot ulcers form. So if you have neuropathy, you have decreased ability to feel, right? So you get increased pressure points in your feet because the fact that you can't feel anything, and these can then become wounds. And also a normal cut, in a diabetic patient, a normal cut or a normal scratch or just a blister can actually become a wound. Why? Because the reason why this happens is because of what we have mentioned, that the blood that is now getting to your feet is now compromised. So neuropathy and peripheral vascular disease are the things that really cause ulcers. The other thing is that diabetes also causes your skin to be dry. So if your skin is dry, it can break, and then you can end up having ulcers from that. So that's how the ulcers form.
Now, considering the fact that the end goal in proper diabetes management is so we could have a better quality lifestyle living with the condition that we have. So I don't know if you could now share with us to say, how can a diabetic foot ulcer be treated? I mean, because we might have already people that have this condition, they need to know how it's treated, or maybe how it can be prevented for people that are living with diabetes. So, I mean, do we have as many options, or it's only an amputation being the last resort after a complication such as diabetic foot ulcer? Thank you.
Since we are more on the preventative side, we can just discuss about the general advice that our patients that have diabetes can do. So the first thing is that they need to inspect their feet with special attention to the areas that are in between the toes, right? Because we know that in between the toes you can get infections, you can get maceration, so moisture in between your toes. So we need to inspect daily. Inspect also, just as a diabetic patient, you need to have a picture of a normal picture of your foot. The reason why I'm saying that is because if something happens, you can then notice to say, no, this was not there, and then you can seek help immediately. And as funny as this might sound, but our patients need to actually check inside their shoes before they wear them. And our patients have hurt themselves because they have worn shoes that had things inside, and the worst happened. So always check inside your shoes before you wear them. There's a trend that is going on these days of people using corn plasters, these things these products that are advertised to remove corns, remove warts, and because of the chemical component or the chemical agents that are used to make these, they then irritate the skin and can cause the skin to break. So please avoid these things. Avoid putting things on your skin that you don't know, because the chemical components of the product might hurt you. And let us not wrap our toes with bandages, because like we said, if the blood flow to your feet is compromised, if you wrap something around a bandage, whatever it is, you then compromise it more. So avoid wrapping around your toes. And also, when you cut your nails straight across, right? Avoid cutting in the corners, because you might hurt yourself cutting the corners and also put yourself at risk of ingrown toenails. Let us avoid smoking, because like we said that blood flow is compromised. So with smoking, we're just compromising it more. And let us visit our podiatrist regularly for screening, and then they would then educate more on this, or what we have discussed, because there's a lot of things that we can do.
And they say greater conversations with greater people for the greater audience for a good quality life. So if you could share your last words with us, podiatrist, please take it away.
Okay, so lastly, I would say that if you have diabetes, it is very important that you have a podiatrist, or that you find a podiatrist, because a podiatrist will help you with a lot in terms of dealing with your feet. So please find a podiatrist, get trained, talk to your podiatrist about whatever questions, or ask your podiatrist whatever questions that you might have in regards to your feet. And remember that our goal, that we work as a team, and our goal is to just prevent these complications that we've discussed from happening. So that is our goal. We are #NoAmputation team. Thank you so much for having me, Tino. I really enjoyed this conversation, and we look forward to more conversations.
Now to you, our podiatrist, Leevonia. If if you could share with the audience your social media handles, how they can connect with you, how they can share their challenges with you in case they need help. Over to you.
On Facebook, my page is Foot Clinic Harare, and it's a very interesting page. Please like the